Welcome to At Issue. Thank you so much for joining us. I'm H. Wayne Wilson, and this time we're going to be talking about controlling contagious diseases. And no surprise, it's Ebola that is spawning the conversation, although we won't restrict our conversation to just Ebola. Ebola is just one example of a contagious disease that we're trying to deal with across the world, and that's what makes it a little bit more concerning. But a little bit of background. It was in March in Guinea that we found Ebola. It's not the first time. We're going to be talking about that in just a moment. Then it spread to Liberia and to Sierra Leone. And this week, the United States restricted flights from Western Africa to just 5 airports, the closest of which is O'Hare to the central Illinois area. And to have the conversation about how we're dealing with contagious diseases, we've invited Tony Howard to be with us. Tony is the director of the emergency department for Unity Point Health Methodist Proctor, and he also leads the Ebola response team there at those 2 units. Also with us is Dr. Steve Hippler. Dr. Hippler is the Senior Vice President of Clinical Excellence at OSF Healthcare System. Thank you very much for being with us. And you're on the response team there?
Yeah, we have a team of people. We've developed our own internal Ebola response team and then coordinating efforts throughout the city with Unity Point and the health department.
And also here from the health department, the Peoria City County Health Department, is Monica Hendrickson. Monica is an epidemiologist with the health department. And welcome to the program.
Thank you.
And I will add at this point that we invited Advocate to join us, and Advocate, due to scheduling, cannot join the conversation today. So Advocate Broman over in Bloomington Normal cannot be with us. I want to start, before we define Ebola, I want to define epidemiologist.
Of course. So epidemiologist is an individual that uses pretty much scientific principle or scientific research ideas in terms of usually statistics to really look at what are the determinants and factors that influence health as well as the spread of disease. So the best way to say is I use numbers to see why we are the healthy as we are or why diseases spread the way they do.
And we'll talk a little bit about that in just a moment. But first, a definition. What is Ebola?
Ebola is an RNA virus. It's very different than a bacteria, but it's a common virus that we're all used to. You know, I think Ebola has created some scare and fear in people because they hadn't heard of it before. But really, we're in the 45th week now, of the 26th outbreak of Ebola across the world. It's been mostly contained to Africa and small villages in Africa where the CDC and the WHO, World Health Organization, have had boots on the ground and have studied this. So this is not an unfamiliar virus to the CDC and the World Health Organization. They know what it is, and they know the clinical course and what to do to treat it and to prevent its spread.
But it has raised a little bit higher concern this time around because it's spread to multiple countries?
Yes, so in the past, most of the outbreaks of Ebola we've seen are localized within a specific country, mostly in rural communities. This is the first time the WHO has actually listed this outbreak, this 2014 Ebola outbreak, as an epidemic because it's spreading to multiple countries.
So how concerned should we be in America? We have a sanitary system that's a little bit stronger than most African nations, et cetera. So is it a real concern here?
Well, let's go back to what Monica just mentioned. Most of the outbreaks in the past have been in smaller, more rural communities in Africa. And it's thought that it's spread because of their funeral practices. You know, Ebola is also called hemorrhagic fever because patients who get Ebola and pass away have a lot of bleeding. And it's in that blood of the patient dying of Ebola where the virus lives and is infective, okay? In Africa, their funeral custom involves having the family wash the body and cleanse the body after death. And then they spend a day with it afterwards as part of their funeral and their grieving process. So it's family members and close contacts coming in contact with the blood of a deceased Ebola patient where it spreads. So part of the eradication efforts that have been directed to the African subcontinent has been really education around funeral practices and changing funeral practices and getting away from contact with the blood of a patient dying of Ebola. So in the United States, we have different practices. We have different sanitary processes, different sewage systems, better protective equipment. So the likelihood of it spreading in the United States as it did in the African subcontinent seems to be significantly less, H.
We've had one patient die in America, Mr. Duncan, down in Texas. Two nurses that were treating Mr. Duncan, Nina Pham and Amber Vinson, contracted Ebola. The word from Texas Resource, which was the hospital that handled that case, is that they violated protocol. They had a protocol in place, and it was violated, and I believe, correct me if I'm wrong, but I believe it was a case of discarding the protective equipment. You'll hear PPE discussion here in a moment, and that's personal protective equipment. They discarded their PPE in an inappropriate manner.
That's correct. That's what they're saying. So that's what we're doing at the hospital level, is re-educating staff on how to appropriately put on their PPE, but more importantly, how to doff their PPE, take it off without contaminating yourself. So we went to a two-person process. So you actually have the person that is putting on the equipment, but you also have a partner that is doing a 360 view of you, making sure you have everything covered, and they're also coaching you on how to take it off. They may tell you now, be careful, H, you have contamination on your right arm. So they're coaching you as you're taking it off as well, so you don't, and if you, like maybe you're going to reach up with both hands to remove your mask, and they'll remind you, don't use both hands, just use one hand. So that's a practice that we put in place.
And these are new protocols that you've put into place, or more strict?
More stringent protocols. We've always used protective equipment with contact isolation, but we have changed with the CDC changes that they recommended as far as covering from head to toe. That's what we've implemented as well. But the two-person process, that's something new as well. But it's helped the staff, especially with the coaching part, having that extra person to remind them how to do it. Use one hand. Okay, you're in the contamination area. Be careful on your right arm, things like that. So that's really helped.
Are there any changes in the protocol in how you handle a patient?
Well, that's one thing that we've implemented. We had to change our electronic medical record with our screening questions, especially with Ebola. It's key to know if they've traveled outside the United States within that 21-day window and been to one of those countries where there is an outbreak. So that's one of the questions that we're asking up front in the emergency room, or if you go to a clinic, or if you're going into an outpatient area. So we're screening everyone that comes into the hospital. Have
any changes been made within the room while you're actually treating the patient, in terms of once you've put on your PPE, have you changed protocol there?
We've only changed protocol based on the CCD guidelines as far as how do you dispose of it, triple bag, things like that. Some small minor changes.
And he mentioned CDC. This must be difficult, because I think there are notifications coming out on a daily basis almost from CDC and maybe from World Health Organization as to proper protocol. How do you keep track of all of this?
They've done very good at keeping really the entire country informed to the best information. And honestly, H, we don't take this as a negative. We want to have daily notification of what the absolute best thing is to take good care of patients and protect our caregivers. So our response team meets 2-3 times a day. We always have the latest information, and it goes right from there to our portal. So we post that portal both internally and externally so that we can get communication out about what is the right thing to be doing today.
At the health department, you deal with a variety of patients who come in. What is your protocol? Is it similar to what the hospitals are doing?
A little bit different in the sense that we never usually see patients in terms of the same scope that they come into an emergency department or a prompt care, for example, or an outpatient facility. We usually see mostly healthies that come in for either immunizations or clinic testing, or for some of our other services. However, with that in mind, we do already have in place protocols that we use for bloodborne pathogens as well as for tuberculosis. So if someone is coming in that has been tested positive or a suspect positive for tuberculosis, which is airborne, we have protocols in place as how we work with them, how we monitor them, as well as how we interact with them. So we do have those protocols in place. And the interesting thing to remember about the case in Dallas with Mr. Duncan is that the family he was staying at, none of them actually developed Ebola. In fact, they've been cleared, I think, 2 days ago.
Yes.
And that's because at the early stages of the disease, or the virus, your viral load is very low. as it progresses, as you get sicker, you're going to be seeking medical assistance rather than the health department or staying at home. And at that point, when your viral loads are increasing and you're expulsing, either different types of body fluids, that is when transmission and exposure are at its greatest. And that really usually happens within the healthcare setting. And this was the case we saw with those two nurses. They were working really directly with, Mr. Duncan when he was at the peak of his viral load.
And that's one of the issues we've had to really wrestle with and create clarity around, because as Monica mentioned, the family didn't acquire this, nor did the emergency room staff who encountered him the very first time when he had a temperature of 103. So a lot of the recommendations that are being put out is for caring for a patient with active Ebola virus who is producing secretions that might be infective. Yet today we know in our healthcare facilities, our caregivers will be confronted with patients who have a fever or who have nausea and vomiting. And we really want to be sure that we're giving them the right information, the right tools, and the right protective equipment so that they can continue to care for patients like they always have without fear for contracting something like Ebola.
I think that's the important thing to note about Ebola is that unlike other viruses or diseases, you are communicable or you're able to transmit it once you are symptomatic. So you're actually developing active symptoms is when you are able to transmit it. So when we look at other diseases that you can transmit while you're asymptomatic or on early stages, it's a different scope. And I think that's why when both medical units in our community have talked about the fact that they're asking these rigorous screening questions, specifically about travel history, that's to create that understanding of there's a separation between someone that comes in with a fever versus someone that comes in with a fever that has had contact or exposure to someone from a very specific part of the world.
When Texas Health talks about a breach in protocol occurring, I think some took this as to mean that the nursing staff or the caregivers just didn't follow directions, and I think unfairly perhaps targeted them. As you see now, the CDC is now directing cases to specialized facilities across the country because they have the biocontainment units, because part of this is protocol age, but part of it is also being set up as a biocontainment unit where there are the appropriate incineration facilities, the appropriate water handling facilities, the appropriate air handling facilities that, our ICUs do a great job caring for patients, but they're not set up to be biocontainment facilities.
So we've seen Emory in Atlanta, Georgia, handle Ebola. We know that in Chicago there are 4 hospitals that have kind of networked together. They are Rush, University of Chicago Northwestern, and Lurie Children's. Now, they have said they want to reach out to other Illinois medical centers. Have they contacted Methodist yet?
They have not yet.
And OSF?
Yeah, we're working through the health department, because I know the health department through the state and local health departments, through IHI, the Illinois Hospital Association, is convening groups as we speak to understand how we build this network in Illinois, both for Chicago and for downstate.
So has there been discussion yet at your level?
At our level, we know that we've been told by the state that they are contacting or looking into different hospital systems south of the Kankakee, kind of northern Chicago area border. And right now, those 4 hospitals, their proximity to O'Hare, where you're going to see the likelihood of a traveler versus our area, is really the good starting point. And now it's really working down to see what other points of interest that they might be looking at as well.
Because someone from West Africa may fly into O'Hare, not display any symptoms at that point, and then fly to Peoria or to Bloomington, and that could cause a problem.
Right.
So I want to go back to your point, Dr. Hippler, is that Dallas, the Texas Resources Hospital, may not have been totally, not that they weren't prepared, but they didn't have all of the rooms set up, the proper airflow. So do we have to worry about that at OSF or at Methodist Proctor? I mean, is that a concern, that if someone did present themselves?
Yeah. Texas Health did a very good job of sharing their experiences with us, and work is underway now for us to prepare a place for patients to go if needed that's not in one of our acute care facilities. So we've learned from what they did, and we have some active emergency planning going on today.
And Tony at Methodist and Proctor?
It's the same thing, because one of the things that we learned is their company that took care of their infectious waste needed a contract to handle Ebola. So that's one thing that we actively are working on to make sure our contractor that takes all of our infectious waste off has a contract to take, if we did have an Ebola patient, all that waste. Because that was one of the things I think in Texas, it just kept piling up in a room, which would be a problem.
So what happens to that waste if that were to occur?
That it would be taken off and incinerated, but a licensed company has to do it.
I think that was actually really interesting is that public health as well as the healthcare community have always been tasked for years now about developing emergency preparedness plans about operationally how they would handle various infectious disease as well as possible bioterrorism threats, etc. And I think those plans are in place. This is definitely an opportunity for us to review them, make sure that we are meeting different criteria and really understanding how we will take from the plans and actually do it operationally. One of the things we also learned was the fact that not only just with the waste management was, I think it was Emory that had a situation where they were tempted to shut off sanitary services to the hospital because they did not feel that Ebola should be flushed down the toilet. And so they, things that we never really thought about, but in the scenario, people have, felt that they needed to go above and beyond precautions. So now I believe the hospital is putting bleach into the toilets, letting it sit for 5 minutes before they would flush it. And then that understanding was developed for them, and then they could actually utilize the system.
So it sounds like Ebola, the virus, isn't that difficult to kill once you isolate the virus.
Correct. As Monica mentioned, we've seen the same protocols around, bleach in the toilet bowls so it doesn't get aerosolized or put into the air, and simple incineration of the materials once they're stained and soiled.
And because we have to remind everybody that when you flush the toilet, not all of the water goes down. There is a mist that does pop up.
But let me also say, it is not an aerosolized virus. I think a lot of what you heard about people being afraid to go on planes or sit in the same waiting room as someone with Ebola is because people are thinking about this the same way they think of the flu, in that it's mysteriously in the air or you can catch it with a cough or a sneeze. And we know that that's not true, that it's spread through the blood and bodily secretions of a person who has advanced Ebola disease, which is really very unlikely for the average person to encounter in their daily life.
Would that include sweat?
Potentially, yes.
Okay. I want to stop talking about Ebola for a moment. I know it's the reason we're here, but we have other diseases that we need to worry about much more than Ebola because they are present in Central Illinois and because they're more easily spread. Has Methodist and Proctor, has your response team addressed those particular issues?
Well, prior to Ebola, the endovirus, that was something that has came around, so we did a lot of education with our staff as well on that. And we're starting flu season, so we're making sure everyone's getting their vaccination. So that's what the public really needs to do to protect themselves, is get their flu vaccination.
Contagious diseases from your perspective, Ebola is not the one to worry about?
Absolutely. We've had similar preparedness efforts around the enterovirus that's been going around. And really are ramping up our flu and pneumovax immunization protocols because, for the average listener, the average person, really the thing they can do is to really get their flu shot. If they qualify for a pneumonia shot, get their pneumonia shot, and really over the winter months, continue to practice good hygiene, hand washing, stay out of the public if you're sick, because every year there's an influenza outbreak. It seems it's just a matter of how severe it is. So really people ought to be focusing their attention not on Ebola, but what they can do this fall and this winter to protect against influenza.
Are diseases like flus, are they transmitted differently than Ebola?
Absolutely. Influenza is more airborne, so you can get it through coughing, sneezing. Ebola is direct contact with the virus and the secretions of a person with Ebola disease who's advanced in their course, which typically will only happen in a healthcare setting.
And because it's more easily spread, do you have protocol in place when a medical personnel at your facilities is exposed to flu or enterovirus or things of that nature?
Yeah, we have protocols in place. We actually have signs at our entrance, especially when flu season starts. If you have a cough or running a fever, we have a hand washing station and masks that we ask the patients to put on, and then staff would also wear masks. And we really encourage all of our staff to get the flu vaccine too.
And at the health department, you're more likely to be exposed to flu or something of that nature than Ebola.
Yes, definitely. And similarly, we make sure that all of our staff are getting immunized as well, vaccinated for the flu, as well as providing that messaging to the public about where they can get the flu shots and what kind of precautions they can take. And sometimes public health can be seen as, the boy that cried wolf, or kind of the same record that overplays, but it is really good hygiene. Hand hygiene, the 3 C's, cover, contain, and clean. Pretty much you can't go wrong with that, and a lot of different viruses and bacteria.
I want to talk about communication for a moment on 2 different levels. Communication with the public, but communication amongst yourselves, because we all know the story. OSF, Methodist, Proctor, hospital wars, things of that nature. You're really working together.
Yeah, we are one community, that we're reaching out to Unity Point, sharing everything we've gotten. IDPH, Public Health Department, is convening a meeting today. So AMT, all the transport people will be there. This is really being approached from a community perspective.
And that's one thing we haven't mentioned is AMT, the ambulance company in Peoria, or any other ambulance company. You communicate with them, work with them to make sure that the symptoms of a patient coming in, you know them in advance.
Right, and that's something they've implemented with the 911 system. That's if a person calls in, they're asking those screening questions about travel at the 911 level, so they could alert the EMTs, before they get to the patient's home.
And you've touched on communication with the public before, but is there a more concerted effort to make sure that the public understands it's not Ebola that we should be talking about, it's everything else with winter coming?
Definitely. Most of our press releases really for Ebola has been really to calm people's fears and just give them an understanding. But you'll see here that most of our information that we push out this time of year really does focus on influenza, getting vaccinated. And in terms of how we work with the healthcare community in coordinating response and communications, this is not, with Ebola, it's not the first time we've done this. During H1N1 in 2009, the committee that's actually meeting is the one that was created off of that to actually coordinate different community partners that are traditional, such as our healthcare community and our EMS services, but also non-traditional that we're looking at in terms of schools, government officials, as well as like state's attorney's offices and 911 call centers. So one of the things I find interesting is that we have a lot of these communication conduits in place and to be able to talk to each other. It's always there. We use it daily, but it gets magnified when we have a response or situation such as Ebola.
And the general public doesn't see that normally until there's an outbreak like this. But the public health departments have done a great job at pulling all the stakeholders to the table so that we're all on the same page and working together for this. Monica mentioned it's sometimes thought of as the boy that cried wolf, but beneath that surface that most people don't see is a very robust system to keep us all connected and keep the right information in the hands who need it.
And the communication, getting the proper communication out from the right source is so critical, because with the internet, I imagine you've seen some wild stories.
We have had some wild calls come into the emergency department as far as, I was born in Dallas. I think I have a bullet. Well, were you in Dallas recently? No, but I was born there. So we get a lot of weird stories coming in, yeah.
So it goes back to the communication. And it has to be consistent, though, amongst all of you, IDPH, everybody.
And I think that's where, again, the public may be not fully aware of how it works, is that the CDC, or the Centers for Disease Control and Prevention, do have what's known as a Health Alert Network, or HAN as we call it. And it's all the hospital systems, long-term care facilities, you name it, they are registered on this and get information pushed out to them. And in terms of the Illinois Department of Public Health, or IDPH, they pretty much utilize what the CDC is doing in pushing out into, information. Now, their message might change slightly in terms of being much more specific, such as in this case, we know the Chicago hospitals are now aligned to take, people that are under investigation or possible isolation and quarantine information. It kind of gets directed for each state or jurisdiction, but the same information does get pushed out.
a final real brief thought on don't worry about Ebola, we're okay.
Yeah, I think we all have to keep informed and understand. Our opportunity is to keep everybody educated and prepared. But as we've seen, there's been 3 cases of Ebola in the United States, 1 index patient and 2 from healthcare workers. And the healthcare system is responding appropriate. So I think for the average listener out there, it's really use this as an opportunity to really get your flu shot and understand how to keep yourself safe through flu season.
And with those words of wisdom, we want to say thank you to Tony Howard from Unity Point Health Methodist Proctor. I'll get used to the new word sooner or later, a couple of years. Monica Hendrickson from the Peoria City County Health Department, an epidemiologist there. And Dr. Steve Hippler, as always, thank you for joining us from OSF St. Francis. And we thank you for being with us on At Issue. Next time, a special start time for At Issue will be on at 8 o'clock next time, or 4 o'clock if you're watching on Sundays. And we'll have the 2 congressional candidates from the 17th Congressional District, Sherry Bustos and Bobby Schilling. Thanks for being with us on At Issue.